Welcome to Adapt NCLEX. Let's do some questions, priority questions. So we have a priority question, and then as you know, a priority question, you got to think being B sharp. Um, it's a B sharp moment. Make sure you don't cause any morbidity to the patient. And so the way we answer questions is we read the last portion of the question. So which of the following need immediate intervention? So our ask is we need intervention. Okay, this is a priority question, and therefore it's because of immediate. Then you go to your case, what kind of case you have. We read the rest of the questions. A client with history of bipolar was admitted for acute maniac episode. At discharge, client was placed on lithium. Which of the following need immediate intervention? So all we know is a case, we have a bipolar patient who is now on lithium. That's all. Then you go to your buzzwords. These are the keywords that will direct you to the question. You know, patient is a bipolar patient, and I went into a maniac episode, was placed on lithium, and it's going to be discharged. So all I care about bipolar patient on lithium. Okay, and then after you do your passwords, then you basically you rewrite your statement. All these 3 lines, you have to rewrite it so that you can take ownership of the question. Basically, the rewrite means bipolar patient with on lithium. That's all. What do I look for? That should be worrisome. Before you look at your answers, go with your content. Lithium is the drug of choice for patients with bipolar, but it has side effect. It's very narrow therapeutic effect range. So it's 0.6 to 1.2. So that's the range. Okay. So that's the range for these patients. And then if you get to like 1.5, that's a toxic level. And so this patient may need this lab work to be checked frequently. Things to avoid. Avoid anything that affect kidney injury. So anything that affect kidney injury, you need to stop that. And then you should avoid dehydration. Those are the keys. So anybody on lithium, avoid kidney injury and avoid dehydration. And that's all. Those are the few things you need to ask yourself. I don't want to go into details, but you have to come up with a few content to guide you. And then from your rewrite, you go to your choice. So your ask, case, buzzword, rewrite, and your choice. You got to make a choice. You go and start from the top and make a choice and see if it's in line with your rewrite and your content. You're using your content to answer the question. I will need frequent lab draw. Yes, with the narrow therapeutic range, yeah, you need a frequent lab draw. So I don't need to intervene. I will drink 2 to 3 liters of water a day. Avoid dehydration and injury to the kidney. So no intervention. I will start taking Motrin for my back pain. Yes, you ask yourself, why Motrin for back pain? Why is this here? NSAIDs are always bad in your exams. When you see NSAIDs in your exams, well, it's really bad. Why? Because everybody have access to that. So we abuse it. We take it unnecessarily and we cause problem. Motrin, if we take Motrin, it causes injury to the kidney. And that will increase toxicity of lithium. So we need intervention. I will call my PCP if I develop nausea and vomit. The early signs of lithium is GI toxicity. This is the same thing as the digoxin. Early signs is GI toxicity. So you need to call your doctor, and that's true. I don't need to intervene. So the right answer is 3. The patient should stop taking any Motrin, anything that will cause injury to the kidney. Second question. So we have the same thing. A client with trigeminal neuralgia was prescribed carbamazepine for pain for the past 6 months. Remember, carbamazepine can be used for trigeminal neuralgia. Which of the following need priority action? So you go with your acts, you go back. Which of the following need priority action? So I got to do some action. Then we read a question. You know, patient has trigeminal neuralgia, right? So that's the issue, trigeminal neuralgia. Then we our buzzwords are what? Trigeminal neuralgia, patients on carbamazepine. That's all. So your rewrite is the same thing, carbamazepine on trigeminal neuralgia. This mental process will keep you focused and therefore give yourself a content. And when you rewrite, then use it to answer the question. Every medication that you have to know, make sure you know the side effect. Carbamazepine is used for seizure, okay? But you can also use it for trigeminal neuralgia, neuropathic pain. Basically, it's a sulfur drug, okay? It's a sulfur drug. So sulfur drug usually have what? Hypersensitivity. And the most serious effect of sulfur drug is Stevie-Jones syndrome. Okay. There's other side effect too. It can also gain weight. And there's one more of carbamazepine that we will see it in the next question. So I'm not going to say that. So, but this is what we have. And is carbamazepine is removed from the body through the kidney, so not from the liver. So it's the liver metabolism of the carbamazepine to get rid of it. So that's the information I have. I'm going to use it to answer the question. Sunburn on the face and after a long walk in the sun. Yeah, this is sensitivity, which is okay. It's not that bad. It's not an allergic reaction. It's fine. It will go away. So even though it's a side effect of carbamazepine, you should not let those non-priority actions of medications distract you. They are distractors. Yes, when you're taking it, you get photosensitivity, but that's not the priority. I'm looking for something that will kill the patient. I have to be sharp. Be sharp. I will avoid grape juice. If you watch my pharmacology videos, grape juice and NSAID are your enemies. Okay, they never a right answer. You never pick them. Grape juice, it goes to the liver and it destroys the liver enzymes that break down chemicals, and therefore this is good answer. Okay, I will avoid it. So avoid it. It's not a priority action. Doing that is good. Small purplish spot on the chest. Then you ask yourself, why there's a small purplish spot on my chest? This is the beginning of Stevens-Jones syndrome, and this will spread throughout the body. And sometimes they use the word squamosization of the skin. Basically, the skin will peel off, peeling of the skin. This is the toxic syndrome, and the patient will die. So, thus, we need to intervene. A 5-pound weight gain is fine. It's not fine, but that is expected. So the problem is number 3, which is a small purplish spot on the chest. And that's how you answer question using the ask case buzzwords, rewrite, make a choice and move on. You got to move on as you make a choice. But carbamazepine, this is one of the side effects you should know. Focus on the most important side effect. Not every side effect is important. Okay, so I think we have one more then with that. And this is caring for 4 clients, okay? We need immediate intervention. So who needs some intervention right away? A client on albuterol with 3 hours of sleep at night. What does that mean? This patient has insomnia. It's not sleeping at night. Why? Yeah, that's the common side effect of albuterol. Insomnia. So this is an expected finding. I'm not going to be sharp about it. The client on dicyclomine with dry mouth. Yeah, you ask yourself, why do you get dry mouth? Anything that will decrease acetylcholine production will make you have dry mouth. And dicyclomine is anticholinergic. So anticholinergic. So it blocks acetylcholine function. Therefore, you have dry mouth. This is expected. A client on carbamazepine and sore throat with runny nose. One thing about carbamazepine, apart from what we said on the previous slide, is it causes agranulocytosis. And this will lead to sepsis if you don't do anything about it. Any small infection can lead to sepsis. And this is our patient. This is the B sharp moment, where S is a B sharp sepsis. So you got to be careful, and then you got to make sure anything they talk about, any small running nose, sore throat, don't ignore it. This is our priority. Let's look at it number 4. A client on terazosin with systolic blood pressure decreased from 150 to 130. What do you think? So this is an alpha blocker. You use it for BPA. And then the common side effect is orthostatic because he acts centrally acting. That means he goes through your brain and do his thing, and he helps you with whatever problem you're having. If your systolic blood pressure drop from 150 to 130 systolic, that's a definition of orthostatic. Therefore, this is orthostatic hypotension. This is unexpected from terazosin. That's what you see when patient on it. Therefore, you tell them to get out of bed slowly. So this is not a priority patient. The only priority patient is the one that has the Stephen Johnson early signs of that. Therefore, we need to intervene. This is all I have for you. Quick questions by illustrate very important thing. Work on the ask case, buzzwords, rewrite, make a choice and move on. And you see how things can go. You can send me an email message on my YouTube, what kind of questions you guys want to work on, and I'm ready to help at any time. Take care of yourself. Have a blessed day. As always, keep charging.